right, let's dive in. Today, we're all about those pearly whites, that awesome smile. We're talking adult oral health, folks, and we've got some seriously interesting research to guide us.
Think of this as your cheat sheet, not just, like what is oral health, but like why it matters and how to actually make it happen, how to do it.
I love that. A cheat sheet for healthy smiles. Okay, so to kick things off, let's start with a fact. A fact that might just make you like rethink your whole oral health game.
Ready? Ready? Bring it on.
The average adult between 20 and 64 has, wait for it, 25 natural teeth left.
25. That might sound kind of low to some people.
Right.
But honestly, you're actually part of a generation that's keeping more teeth than ever before. And a big reason for that is fluoride. Like, think about it. Fluoride's been around for like over 70 years now.
Fluoride, yeah. I remember those treatments as a kid.
Yeah.
But I never really got why they were such a big deal. I just, did what the dentist said.
Right, right. It's kind of like fluoride is like a secret weapon, a superhero for your teeth.
Okay, a superhero. I like that. So what does it actually do?
Well, basically, it makes your enamel stronger, tougher, so it can stand up to all that, acid that causes cavities. And that means, that means way fewer cavities, less decay, even, discoloration, that your teeth stay whiter.
So it's not just about those like treatments we got as kids. It's about the long game. It's like fluoridated water, for example.
Exactly. Yeah, it's something we don't even think about, right? But that's what public health is all about, just like simple things that make a huge difference, like for generations.
Okay, so we've got fluoride working its magic, but what else can we do to keep our smiles, in tip-top shape? Like what are the secrets?
Well, the research it actually highlights 8 key habits.
8. Okay, I'm ready.
And it's not all about brushing and flossing, although those are definitely like the foundation.
Okay, yeah, the basics. But give me the insider tips. What are we missing?
All right. Well, so, we've got the brushing twice a day with fluoride toothpaste, of course, and flossing every day. And seeing your dentist like at least twice a year, those are non-negotiable.
Right, got it.
But then we get into the stuff that people tend to overlook, like getting screened for oral cancer, for example, and gum disease. Those can be like really sneaky, silent threats. So early detection is key.
Yeah, that makes sense. Early detection, always a good thing. What else tends to fly under the radar?
Well, we already talked about fluoride, but beyond that, it's really about lifestyle choices, like avoiding tobacco, not smoking, and limiting alcohol, and managing dry mouth. Those things all play a role in your oral health.
Dry mouth. Okay, gotta admit that one sounds a little out there. Like what's the connection there?
Think about it. Like when your mouth is dry, it feels like a desert, right?
Yeah.
That's dry mouth, and it can be more than just uncomfortable.
Right.
You see, saliva, it's really important. It neutralizes acids, washes away food, all that stuff. Without enough saliva, well, you're more likely to get cavities and other problems.
So is it as simple as just drinking more water?
Drinking water definitely helps, but it's important to, figure out what's causing it.
Right.
Could be medications, lifestyle stuff, even certain medical conditions. Sometimes it's, simple things like cutting back on alcohol or sugar and tobacco, obviously. But if it's like really persistent, your dentist might have some, specific recommendations like things to stimulate saliva production.
Huh. Interesting. It's a good reminder that oral health is like it's connected to our overall health in so many ways.
Absolutely. And speaking of connections, let's talk about some common conditions that can affect your oral health as an adult.
Okay, let's do it.
First up, untreated tooth decay. Dun dun dun.
Okay, that sounds a little scary. What are we talking about here? Like, break it down for me.
Well, it all starts with, those little cavities, but if you ignore them, they can turn into like bigger problems, like dark spots that just keep growing. It's like a monster munching away at your tooth.
Okay, wow, that's a pretty vivid image. So why is it so important to catch it early? Like, what happens if we just, try to ignore those little monsters?
Okay, imagine a small crack in a route.
Okay.
Over time, if you don't fix it, it gets bigger and deeper, right? And eventually it's going to cause some serious damage.
Yeah.
Same goes for tooth decay. Those cavities, they can reach the pulp of the tooth, and then you can get infection, pain, you could even lose the tooth.
Ouch. Okay, that's a good reminder to stay on top of those dental visits.
Definitely.
Okay, what about periodontal disease? I hear that term a lot, but I'm not really sure what it is.
So periodontal disease, or PD, it's basically a serious gum infection,
Okay.
and it doesn't just affect your gums. It can damage the bones that support your teeth, and it's actually one of the main reasons why adults lose teeth, and it can even affect your overall health.
Wait, so gum disease can go beyond just the mouth.
Yeah, it's true. There have been studies that have actually linked PD to some pretty serious health issues like heart disease, stroke, even diabetes.
Wow.
The thinking is that the inflammation from PD, it might actually contribute to those conditions.
Okay, that's a serious wake-up call. So what causes it? Is it as simple as just not brushing and flossing enough?
Well, good oral hygiene is definitely crucial,
Right.
but it's not the whole story. Smoking is a huge risk factor, and age, genetics, certain medications, even conditions like diabetes can make you more susceptible.
So it's a complex issue, like a lot of different factors at play. Okay, so what other conditions should we be aware of?
All right, let's move on to something that a lot of us are probably familiar with, the breakdown of dental fillings. You know, those little patches that fix cavities.
Yeah, I've got a few of those myself.
Even the best fillings, they have a lifespan, you know. They can wear down, they can chip, crack over time, and that leaves gaps, for bacteria to get in, food particles. It's kind of like a pothole that eventually needs repaving.
So ignoring a damaged filling is basically like ignoring a pothole. It's only going to get worse.
Exactly. And it can lead to, more decay, gum disease. You could even lose the tooth. That's why those regular checkups are so important, to catch those issues early.
Okay, regular checkups officially on my to-do list. What else should we be adding to that list?
Let's talk about something that I think a lot of people experience. TMJ disorders.
Oh, the dreaded jaw pain. Yeah, I'll admit I've definitely felt that after, a long day of, well, talking. But is it something to be like really concerned about?
Well, occasional jaw pain is pretty normal, but for some people it becomes a chronic condition.
Okay.
It's called temporomandibular joint dysfunction, or TMD. Basically, it means that the jaw joint and muscles, they're not working properly.
So what are the signs that it's more than just, regular jaw pain? Like how do you know if you've got TMD?
Well, you might have earaches, headaches, trouble opening and closing your mouth. You might even hear like clicking or popping sounds in your jaw, and in severe cases, your jaw can actually get like stuck.
Stuck?
Yeah, stuck, open or closed. It's called lockjaw.
Oh wow, that sounds pretty intense. So what causes TMD? Like what brings it on?
Stress and anxiety are big culprits. When we're stressed, we tend to, clench our jaw, grind our teeth, and that puts a lot of strain on the TMJ.
So you're saying like our always on, digitally driven lives could be contributing to jaw problems.
It's definitely possible. Other factors can include, teeth grinding, misaligned teeth, jaw injury, even arthritis.
Okay, so lots of potential causes to be aware of. What about another condition that I think is often on people's minds, oral cancer? It feels like something people are almost afraid to even talk about.
Yeah, it's definitely a serious topic, but it's important to be aware of the risks and know what to look for.
Right.
Oral cancer, it often goes undetected in its early stages.
Oh, wow.
So regular screenings at the dentist are really crucial.
So what are we looking for? Like what are the signs?
It often starts with growths or sores in the mouth that don't heal, and it can affect more than just your gums. We're talking cheeks, lips, tongue, the floor of your mouth, even your sinuses and throat. And if it's not caught early, it can spread to other parts of the body, like the lymph nodes.
Okay, that's why early detection is so important. So what are the common causes? What causes oral cancer?
Well, tobacco use, both smoking and smokeless, is a major risk factor, as is excessive alcohol consumption. But it can also be caused by things like a family history of the disease, chronic dental issues, even certain strains of HPV.
HPV. I thought that was mainly linked to cervical cancer.
It is, but some strains of HPV can also cause oral cancer.
Wow.
which, just highlights how important the HPV vaccine is.
Right.
It can actually protect against both.
Wow, there's a lot more to oral health than I realized, from fluoride to fillings to the link between gum disease and overall health. It's clearly a much bigger picture than just, brushing and flossing.
It really is. Taking care of your mouth is about, protecting your overall health and well-being. It's all connected.
Absolutely. And we're just getting started. Welcome back to our deep dive. We're continuing our exploration of adult oral health. We've talked about some of the risks, some of the things that can go wrong. But now let's focus on solutions. Let's talk about what we can do to protect those smiles.
Yeah, absolutely. It's all about, taking action, making those healthy habits stick.
Okay, so let's talk strategy. What are the best ways to keep our teeth healthy for years to come? Like what really works?
Well, it all starts with, those 8 essential habits we talked about before: brushing, flossing, regular dental visits. That's the foundation, the non-negotiables.
Right. Yeah, those are key. But I'm guessing there's more to it than that. Like, what are some of the less obvious things we can do to really up our oral health game?
You might be surprised to learn how much your diet affects your oral health.
Oh, interesting. Okay, I'm all ears. Tell me more about this food-teeth connection.
Well, the biggest culprits are sugary foods and drinks. Basically, the bacteria in your mouth, they feed on sugar, and that process produces acids, and those acids attack your tooth enamel.
So it's not just about like candy and soda. There are other things we need to watch out for.
Oh yeah, definitely. Lots of things that seem healthy, like fruit juices, even some sports drinks, they can be loaded with sugar.
Okay, good to know. So what should we be eating to support our oral health? Give me the good stuff.
Foods that are rich in calcium and phosphorus, those are great for strengthening teeth. So things like dairy products, leafy green vegetables, almonds,
Okay, so strong bones, strong teeth makes sense. What else?
crunchy fruits and veggies like apples and carrots.
Oh yeah, I love those.
Those can actually help clean your teeth as you chew.
Really?
Yeah, they stimulate saliva production and help scrub away plaque.
So wait, so snacking can actually be good for your teeth. That's my kind of health advice. What about chewing gum? Is that a friend or foe?
Reviewing sugar-free gum after meals, that can actually be beneficial. It gets the saliva flowing, which helps neutralize acids and wash away food particles.
Sugar-free gum check. Any other surprising tips, things we might not know about?
Here's one. Consider switching to an electric toothbrush. They're often more effective at removing plaque than manual brushes, especially, if you have any dexterity issues.
Okay, tech meets teeth. I like it. What about mouthwash? Is that a must-have or just a nice to have?
Think of mouthwash as like a helpful addition, not a replacement for brushing and flossing. Look for one that contains fluoride and has the ADA seal of approval.
So it's about choosing wisely. Okay, that makes sense. Now let's talk about those dental checkups. We know we're supposed to go, but what actually happens during a checkup? Like what should we expect?
Well, usually it starts with a thorough cleaning by a dental hygienist. They'll remove plaque and tartar buildup, and then the dentist will examine your teeth and gums, looking for any signs of decay, gum disease, or other issues. And they might also take X-rays to get a clearer picture of what's going on beneath the surface.
It's like a full body scan for your mouth. What about screenings for oral cancer? How does that work?
The dentist will examine your mouth, looking and feeling for any lumps or anything unusual. They might use a special dye or light to highlight any areas that need a closer look. And if anything seems concerning, they'll recommend a biopsy.
Okay, so it's a pretty comprehensive process. Now, let's tackle something that I think we all struggle with, those pesky myths about oral health. I feel like I've heard so many over the years. It's hard to like separate fact from fiction.
Yeah, I hear you. There's definitely a lot of misinformation out there.
Let's start with one that I'm definitely guilty of believing, that bleeding gums are normal.
That's a big one. But the truth is, bleeding gums are actually a sign of inflammation and potentially gum disease. It's not something to ignore.
Noted. Okay, what about this one? You only need to floss if you feel something stuck between your teeth.
Another myth that needs to be busted. Flossing isn't just about removing food. It's about getting rid of that plaque buildup, which can happen even in places you can't see or feel.
So daily flossing, no excuses. What about this one? White teeth equal healthy teeth.
That's where things get a little tricky. While, white teeth can look nice, they don't always tell the whole story. Tooth color can vary naturally. And some whitening products can actually damage your enamel.
Right. So it's about overall health, not just appearances. What about the idea that that brushing harder is better?
That's a common misconception, but it can do more harm than good. Brushing too hard can actually damage your gums and wear down your enamel.
Gentle brushing. Got it. Any any other myths we should be aware of?
Here's one that can be particularly dangerous: the belief that if nothing hurts, your mouth must be healthy. The problem is a lot of oral health problems like early stage decay or gum disease, they don't cause pain.
So those regular checkups are crucial, even if you're not feeling any symptoms.
Exactly. Don't wait for pain to be your guide.
Okay, good advice. All right, we've debunked some myths. We've got our essential habits down. What else can we do to really become oral health champions?
Let's dig a little deeper into that connection between oral health and overall health.
Yeah, we touched on this earlier with gum disease, but what other links should we be aware of?
Well, there's growing evidence that poor oral health might be linked to a whole range of systemic diseases. We're talking heart disease, stroke, diabetes, respiratory infections, even premature birth.
Wow, that's a powerful reminder that our mouths are connected to so much more than just our smile.
It's all interconnected.
So taking care of our oral health is really an investment in our overall well-being. Anything else? Anything else we should be mindful of?
Let's talk about the impact of medications. A lot of medications, even some common over-the-counter ones, can cause dry mouth, and as we discussed, that can increase your risk of cavities and other issues.
So it's important to be aware of those potential side effects and talk to our doctor or dentist if we have any concerns.
Absolutely. They can often recommend strategies for managing dry mouth or suggest alternative medications.
So it's about communication, being proactive. What about what about the role of stress and anxiety in oral health? We talked about the link to TMJ disorders, but are there other impacts?
Stress can manifest in all sorts of ways. Teeth grinding, jaw clenching, those are common. And those habits can wear down your enamel and damage fillings. And stress can also lead to, neglecting your oral hygiene routine.
So it's about managing stress, not just brushing and flossing.
Exactly. Finding healthy ways to manage stress, like exercise, meditation, or spending time in nature, that can have a positive impact on both your mental and oral health.
Right, so it's all about a holistic approach. Okay, we've covered so much ground in this deep dive, from essential habits to those pesky myths to the surprising connection between oral health and overall health. It's clear that there's a lot more to it than meets the eye. We're back and ready for the final part of our deep dive into adult oral health. We've covered a lot of ground, but there's always more to learn, right?
Absolutely. There are some really exciting things happening in the world of dental care, like the cutting edge.
Okay, I love cutting edge. Let's talk innovation. What are some of the latest advancements that have you excited? What's new in the world of dentistry?
One area that's really fascinating is the development of new materials for fillings and restorations. We're seeing more biocompatible options, more durable options, things that last longer and blend in better.
So fillings that are stronger and practically invisible. I like the sound of that. What else is happening in the world of dental tech?
Digital dentistry is really revolutionizing the field.
Oh yeah, in what way?
Well, we've got 3D imaging and printing now, which allows for, much more precise and personalized treatments from crowns to implants.
It's like having a mini factory right there in the dentist office. Amazing. What about advancements in treating gum disease? That's a big one for a lot of people.
There are new laser therapies that can target and remove infected gum tissue. They offer less pain, faster healing times. And we're also seeing some promising research in regenerative therapies.
All right, regenerative therapies, what does that mean?
Imagine being able to regrow lost gum tissue and bone.
Wow, that would be incredible. It's amazing to see how technology is transforming, oral health care. But access to these advancements can be a challenge, especially, for people facing financial barriers. What are some resources available for people who are seeking more affordable dental care?
That's a really important point. Dental care can be expensive. There are resources out there though. Community health centers, they often offer dental services on a sliding scale fee.
So checking out those local resources is a good starting point. What about dental insurance? It can be so confusing to navigate.
It can be a maze, but it's worth taking the time to understand your coverage and explore different options. Some employers offer dental insurance plans, and you can also find individual plans through the marketplace.
Okay, so doing your research is key. What about for people who don't have insurance or can't afford even discounted care? Are there any safety nets?
Yeah, a lot of dental schools offer low-cost care.
Oh, that's great.
It's provided by students, of course, but they're supervised by experienced faculty. And there are also dental charities that provide free or reduced cost care to people in need.
Okay, so those options are out there. It might take a little digging to find them. Now let's shift gears a bit and talk about something that's really important, becoming your own advocate for your oral health. What does that look like in practice?
Well, it starts with being an informed patient. Ask questions, do your research. Don't be afraid to speak up if you have any concerns. It's about being an active participant in your care, not just, a passive recipient.
Right, it's a partnership. I like that. So what are some specific questions we should be asking our dentists? Like what do we need to know?
Don't hesitate to ask about your risk factors for specific conditions. Talk about any concerns you have and get clear explanations about, treatment options, costs. Knowledge is power, like they say.
Absolutely. So being proactive and engaged is key. What about beyond the dentist's chair? How can we advocate for better oral health in our communities?
Support policies that promote oral health,
Like what?
like fluoridated water, school-based dental programs, volunteering at local clinics, or donating to dental charities. That can make a big impact too.
So it's about using our voices and actions to make a difference. Well, we've reached the end of our deep dive into the world of adult oral health. We've explored the science, we've debunked the myths, and hopefully we've empowered you with the knowledge and resources to keep those smiles healthy and bright.
Remember, even small changes can make a big difference. Start by incorporating those essential habits into your daily routine, and if you have any questions, any concerns, don't hesitate to reach out to your dentist.
Absolutely, it's about taking ownership, one smile at a time. Thanks for joining us on this journey. We'll see you next time for another deep dive into the fascinating world of health and wellness.